From between days 2 to 5, your milk will hopefully start to come in. As I've said before, it may be delayed up to a week, in which case don't worry, just keep the combination of hand expressing and pumping using Initiate going. If your milk hasn't come in by day 6, we recommend you move across to the maintain setting whether or not you're getting a volume of milk. If your milk comes in before day 6, when you're getting 20 mils-ish in the bottom of the pot, you can start using the maintain setting as well. The maintain setting has got bigger suctions, and what that does is it's much more effective at shifting the milk from your breast. So to make the maintain setting work, again, you would turn your pump on using the on and off button, but instead of pressing the droplet button within 10 seconds, you would wait. And it will come up eventually with, it says initiate press, we want that to go away. It comes up with maintain running. And then it comes up with 3 little teardrops. These 3 little teardrops are doing little sucks, which is what a baby would do to start the letdown of milk. The letdown is where you get a flow of milk. The milk ducts start to contract in your breasts, and it just brings the milk forward for the baby. And that would be the same thing on a breast pump, that you do the little sucks until the milk is stimulated, and when you start to see some squirts, that's when you would then go across to the bigger sucks. To activate the bigger sucks, you press the droplet button. Can you hear the difference? If I turn it up, you can hear it does big sucks. Okay, so you can override it. If you don't press this button, droplet button at all, it will kick in after about 2 minutes. But if you're seeing the milk coming to the nipple tip and you're seeing the squirt start sooner, then you can override it, and you can also flip between the little sucks and the big sucks, and you can be in control of that. To start your letdown, some women it can be a bit delayed. So to start your letdown, what you can do is to do some breast massage. And once your milk comes in, you won't need to be doing hand expressing to collect your colostrum anymore. But if you start by doing some massage anyway to really release that oxytocin and do some hand expressing just to bring the milk to the nipple tip, you can really speed up the process of getting your milk to let down and come in. So that's very advisable. And again, to do both breasts at the same time is really advisable. You will notice though that when the squirts stop, they'll come in after the first 5 to 10 minutes. You'll see some rapid squirts once your milk come in, but you might find that your breast isn't quite fully drained using the breast pump. So once those squirts start to slow down, we recommend that you just do some massage or some deep breast compressions just to really feel around your breast to make sure they're fully drained. And if you're finding that they're not fully drained once the pump has stopped, then you can do some hand expressing into the funnel. You can just hand express and just make sure your breasts are fully emptied each time you go. You will start to see an increase in milk, and you are aiming for about 500 mils plus by the end of 2 to 3 weeks. And that's your milk supply well established, and you're all set up for being able to breastfeed your baby long term. And you just need to maintain those volumes, those 24-hour volumes then. And so by doing double pumping, making sure your breasts are well drained, and making sure your volumes stay up, then you're well away and well established, and we'll be able to help you to progress to responsive breastfeeding when your baby is ready. And I'll be discussing responsive breastfeeding and how to get it started in the next video.